All right, everyone, settle in. Today we are tackling the ultimate challenge, surviving and thriving in nursing school. This is the masterclass. I've been exactly where you are, from practical nursing to my doctorate. I've seen this journey from both sides of the desk. I've divided this masterclass into 3 critical pillars: how to survive the lifestyle, how to master the material, and how to conquer your tests. Part 1. Survival. Remember, nursing school is a marathon, not a sprint. You must pace yourself for the long road ahead. Ask yourself honestly, why did you choose this path? If you want to advocate for people in their hardest moments, you've found your calling. If your only why is the paycheck, the bedside will become taxing very quickly. Find a deeper motivation to sustain your energy. You have a long road ahead, but it leads to an extremely valuable degree and a life-changing career. Stick with it. Start building your team early. You need a cohort of colleagues you can trust, people who will walk this path right beside you. Here's the part that stings. Your social life will be on hold. It's a temporary sacrifice for a permanent, rewarding professional life. Expect your work hours to decrease. You need that extra time to accommodate the busy and demanding schedule of nursing school. Activate your village. Your spouse, your kids, and even your pets are in nursing school with you now. They are your crew. Learn how to ask for help. Everyone needs to pitch in and pull the weight of your now very busy and occasionally overwhelming life. You must start practicing delegation now. Divide and distribute tasks among your village so you can focus on mastering your material. This is the time to learn the power of no. It's challenging but necessary to set you up for clinical success. Part 2. How to study. Studying for nursing isn't like a general ed course. You need a clinical approach to the material. How do you eat an elephant? Piece by piece. Focus on mastering the micro concepts before you tackle the big picture. Always review anatomy and physiology first. If you don't understand the normal, you cannot recognize the abnormal in your patients. This is vital in medical surgical nursing. Your foundation in A&P is 50% of the battle in understanding complex diseases. Get a planner. Map out every class, every topic, and every upcoming exam. Seeing the road ahead keeps you grounded. Set realistic goals. Don't tell me you'll read the whole book. Tell me you'll master 8 pages of fundamentals today. Utilize your resources. Attend tutoring groups, study together, and reach out to your faculty. We are here to support you. Tools like ATI are designed specifically for your success. Utilize them fully to prepare for the clinical reality of the floor. Identify your learning style. Are you visual, auditory, or kinesthetic? Use online tools to find out so you can study smarter. Never cram the night before a test. Your brain needs frequent breaks to process and store all that complex information. Move beyond passive reading. Create flashcards, build concept maps, and take practice quizzes to test your knowledge constantly. Use the nursing process as your study template. Ask, what are we assessing? What's the plan? What is our evaluation? Take care of your equipment, rest, exercise, and hydrate with more than just espresso. Your body is your primary clinical tool. Do not let perfect be the enemy of good. Avoid the trap of straight-A perfectionism if it costs you your mental health. Sometimes passing a test is enough. Pass the exam, move on, and keep your perspective balanced and your sanity intact. Limit activities that divert time from your studies. Scrolling social media or mindless texting can steal hours from your clinical goals. Prepare for class, read the material, and stay focused during lectures. Pay attention, and most importantly, never stop asking questions. Part 3. Test-taking strategies. Taking tests is nerve-wracking, but there are ways to alleviate your fear and anxiety. Master your mindset. Mind over matter. A positive thinking and attitude will empower you to be a better test taker. Do not allow negative thoughts to rule your life. You are not a failure. Your life will go on, and it will be fine. Imagine yourself passing this test. Positive visualization can be incredibly helpful to achieve that grade you've worked for. Spend 5 minutes picturing yourself clicking submit and seeing that passing grade. Make it real in your mind first. The basics matter. Get your sleep the night before, arrive early, and settle your nerves before the timer starts. Read all the directions for the test before starting. Don't let a simple missed instruction be the reason you lose points. Do not rush through the test. Take your time. You have paid for this education. Might as well enjoy the process. Read carefully. Read the question stem thoroughly. Then read every single potential answer before you make your choice. Go with your gut feeling. Try not to change your answers unless you find a clear, logical reason why you were wrong. Do not add more to the story. A question is what it is. Take it for what it is and stop inventing scenarios. When practicing, read both the right and wrong answers. Understanding why something is wrong is just as important as knowing why it's right. You will hit a question that makes you go blank. When it happens, take an educated guess and just move on. I used to have a little chat with the big guy upstairs. I'd say, okay, Lord, is it C? All right, we're going with C. Thank you. Whatever gets you through, do it. Don't let one hard question spike your cortisol and ruin the rest of your performance. Once the dust settles, reach out for an exam review. Come see your professor so you can see which questions you got wrong and why. Understanding your patterns is how you grow. It's not just about the score, it's about refining your clinical judgment for next time. Thank you for spending these minutes with me today. If this masterclass helped calm your nerves, please like, share, and subscribe. I will never ask for money. If you see anyone asking below, it's just spam. My only paycheck is seeing you succeed. My biggest reward is seeing you pass the NCLEX and seeing that RN after your name. That's what this is all about. Always remember, you are not alone on this journey. Now, go study, get some rest, and I'll see you in clinicals.